welcome back to my channel. Thanks for joining me. I'm Amy and this is part 2 of my health update videos. If you haven't watched part 1 yet, then go back and watch that first before you watch this one, and that will detail so far where I'm up to. And just to reiterate, as I've said in my previous video, I'm not a medical professional. This isn't advice, and this is just about my story, what I'm going through, and do your own research, that kind of thing, because I'm doing my research, but you know, it's just for myself. So do your own research if you are going through this type of thing as well. So we left off in the last video that I had I'd been diagnosed in December. I'd been prescribed levothyroxine for an underactive thyroid, and I'd originally gone in because I thought I had PCOS. And at the last appointment that I spoke about in the last video, the doctor had said it might be PCOS, but it's definitely thyroid, and she was sorting that out. So she I had to do I had to wait 6 weeks, and I had a second blood test, and that blood test in January said that my hormone level in my thyroid, which is here, that's why I keep pointing to it, was normal in January, so the medication was working. So that's where we'd got up to. I'm just reading, sorry, I've got my laptop because I've got notes on there. Yeah, so in the January appointment, when she said that my levels were now normal and I had to continue on the medication and book another blood test for 3 months' time. I'm going to have regular blood tests to make sure the medication's working. Oh yes, so also another symptom that I had been having, well, maybe about 4 times in the last 2 years, I have had a really intense and sudden pain in my lower abdomen. So if I stand up sort of here in my stomach, it comes on really quickly. It's really, really painful, and then it stays for probably about 5 days and gets less painful as it goes on. And I only really remembered to mention it to her in the January appointment because I'd had it the week before. So I mentioned that to her, and I also asked about PCOS again, because in the first appointment in December that we'd had, she said that it might be PCOS. But we were sorting the thyroid out first. So I asked what happened with the PCOS test and mentioned about the pain I have occasionally had over the last 2 years. She said that because I haven't had periods, it does suggest PCOS, and the the next lot of blood tests that I'll be having for my thyroid, she would also add on to the nurse that I would need to have PCOS blood tests as well. And she wanted me to have a face-to-face appointment with her so that she could examine me and potentially refer me for a pelvic scan. So I had to wait for the surgery to ring me to make an appointment for the face-to-face examination. They then booked that for the 14th of February, and I went through any changes, any symptoms. She asked me how I was feeling. I said that I definitely don't feel like a zombie when I wake up in the morning anymore. I don't have as much pain, like muscle pain, because that's part of it as well. I used to have really sore feet, which is really strange that something up here that affects your hormones would affect your feet, but it is a thing apparently, and that's not as bad anymore. But I was still having the brain fog, and I still hadn't had a period. She asked me when my last period was. I told her that my last period was October, explained that I thought it was my November one was just going to be late and happen while I was on holiday, because that would be sod's law, but it didn't. She asked if I'd had any kind of bleeding. I haven't. And she asked me if I was pregnant, which I am not. And then she asked me if I was happy for her to do an internal examination. So I kind of said, I wouldn't say happy is the word, but yes, you can do an internal. So what basically happened then was she asked if I would like a chaperone, and I said it's fine, you're fine to do that. So I got on the bed. Basically, it was a bit like when if you've ever had a smear test, a cervical screening test, where you have to bend your knees and then open your knees, sort of like that. And then she examined me with her hands. It wasn't a speculum or anything like you have in the cervical screening. She examined me and she said that she was going to add more blood tests to the blood tests that I'm already having. I think I've just told you that, in April. Oh no, sorry, now in April I'm having blood tests to check my thyroid levels for PCOS, and then for something else that makes your periods disappear, which I think she did tell me, but I need to take notes really in these appointments because I can't remember exactly what she said. But so there'll be 3 lots of bloods taken in April for all of the things that I am experiencing. She's also going to refer me for the pelvic scan, which from research is, I think, using a wand, an ultrasound wand, which would be internal. Sorry about my hand gestures. I'm trying to tell you it all as I can tell you from what I kind of know and the research that I've done, trying not to gesticulate, but I can't help it. Yes, she's going to refer me for the scan, and then I think that's to look at my ovaries, to check out for PCOS and potentially anything else that can stop your periods. So she said to me, and this is different to what the NHS website says, but the doctor said that it is unusual to not have any kind of bleeding whatsoever, but it's not uncommon. I think that's were her words. Yeah, it isn't uncommon, but it's looking likely that I do have PCOS as well as the hypothyroidism, but the scan and further blood tests will tell us. However, on the NHS website for PCOS, it does say periods can stop. So, which she didn't say that doesn't happen, but she kind of made it sound like it wasn't a usual thing, but we'll see. So that's where we're at the moment. I am now waiting for my letter for my pelvic scan appointment. I can't imagine it's going to be quick because there's everything that's going on in the NHS at the moment. They're under so much pressure, so much staff shortages, that I can't imagine that it would be something that happens quickly. But when it does, I will let you know, and that will be the next health update. So obviously I can't tell you when that's going to be at the moment, but as soon as I know, I will let you know, and then I will talk you through what happens in that as well, and if anything else comes up, and sort of the results of what that is. So yeah, I hope these updates are helpful. As I said in my previous video, if you are going through similar and you want to share your own experiences, then please do, but please don't tell me anything scary. I don't want to hear any horror stories because I am quite anxious about it, and I don't need to be made any more anxious than I already am. So hopefully that's helpful. Like I mentioned this in my previous video as well, that I have been in two minds as to whether or not to share this or not, whether it's something that you want to know, but it might help if somebody is wondering about the process. They can see the kind of things that I've had, my process, and if it's similar, as I say, it's not advice. I'm just sharing what I've been going through and what I am going through, and sort of the process of what's happening. But hopefully next time I'll be able to tell you a little bit more, and I'll know a little bit more myself, and I'll be able to deal with what's going on. She did say to me that because hypothyroidism can affect fertility, and PCOS can affect fertility, and obviously I'm not having any periods, that it might be that if I wanted to have children, that I would have to have some sort of intervention, but we'll deal with that as and when. I'm on my own at the moment, so and it might not be that anyway. It might be something else. It might not be something that does affect my fertility, and I suppose that's only something that we can find out later down the line. But yeah, I hope this has been helpful, and please subscribe, and I'll be back with my normal usual stuff as well in between these videos. So yeah, I hope that's been okay, and I will see you next time. Thanks for watching.